tonight's show, we want to focus on health and wellness, as you've said, and especially at a time like this where people normally make their New Year resolutions. And part of those New Year resolutions would be to go to the gym, to exercise, or to have a proper diet. So those are the things that we want to focus on. But before we actually get into that, we have to show a little concern for the situation currently within Barbados, where a lot of people are concerned about the health sector and the actual ability to get proper care at the Queen Elizabeth Hospital. Now, I don't think that all of it is necessarily the fault of the Queen Elizabeth Hospital, but they normally be the ones taking the majority of the blame, and we don't focus enough attention on our polyclinics and our primary care setting, which unfortunately is no better than the Queen Elizabeth Hospital, because I don't think that they're necessarily getting the resources. And you find that a number of persons in Barbados are waiting to a very late stage to actually go to their doctors, their GPs. We have two general practitioners here with us tonight, and I'm certain that they will tell you that in their clinics, they're recognizing, well, persons are not necessarily coming to time that they would want them to. And then there are issues with adherence to medication. There are also issues with adherence to diets and even exercise programs and all of the things that would help to make them well. But looking at our polyclinic setting, you know that for years in Barbados, going to a polyclinic, people always see it as a poor man's thing to do. But more people are actually using the polyclinics in Barbados. And I think that we need to get away from that mindset that the polyclinic is a poor man's thing to do and see it as the first access to proper health care. And therefore, the polyclinic system in Barbados needs to have all of the resources so that when you go to the polyclinic, you shouldn't have to refer them to radiology for an x-ray. Those are things that you should be able to do there the same time, which would help in the diagnostic process. You shouldn't have to send them to the reference lab for simple tests. You should be able to do simple blood testing within the polyclinics as well, which would take a lot of the burden off of the Queen Elizabeth Hospital, and it will help the doctors in the polyclinic setting to identify some of the health issues that persons are coming in there with. We have a lovely polyclinic setting for years, which you have public health nurses who can actually go out into the community with persons who might need help with their diet or exercise or changing dressings, that can do all of these things. But I find that they're not being efficiently and effectively utilized now. And we face a situation where persons are staying at home and suffering in silence because they don't want to have to waste the time to go to the polyclinic and do the runaround game from here to there to there. It's almost like you're pushing draft checkers on a board. And we need to enhance and upgrade our delivery of healthcare services in Barbados to make it more accessible to people. And that is the focus that I would like to take tonight in terms of having this discussion